What's up, everyone? Welcome back to the Daily Sean. Those of you who have never been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably won't ever change. Not unless you have a suggestion. Today's topic, critical thinking skills. Dum, dum, dum. Can they be taught? Can critical thinking skills actually be taught? Or is have or don't have? Born with? Something that you develop over time? Something you look up in a book? Maybe you learn on a video? Maybe you can find it on the internet. Regardless, critical thinking skills are a tad bit important, wouldn't you say? Many nurses out there talk about how important critical thinking skills are. This particular skill can make or break a nurse's career, the success of a nurse. It is the silver lining of a nurse's care. It's pretty important. It's that ability to go, shit, something's wrong. I should probably do something about that. For some reason, it's not something I feel that you can teach. It's something you can sharpen, something that develops over time. You have to actually sharpen the tool. You can't just expect it to show up and poof, I have the critical thinking skills. Thank you, I'm ready. No, something you have to work at. Can't read it in a book, steal it from somebody, watch it in a video. Well, maybe this video. You can't read it anywhere else. There are some things you can do that might help you develop your critical thinking skills. Lo and behold, I have a couple suggestions. 5 things you need to do to develop, mature, sharpen this wondrous thing called critical thinking skills. First one, you better know the normal. How the body works when it's not broken. How are you to recognize a murmur if you don't know what S1 and S2 are? Recognize diabetes if you don't understand how insulin, liver, and pancreas work in your body when it's normal. You need to know normal before you can treat abnormal at any level. An LPN, RN, CRNP, you could be a nurse's aide, doesn't matter. In healthcare, you need to know normal in order to address abnormal. Something as simple as vital signs. You need to know normal vital signs before you can recognize something is wrong. If you think that you don't need to study something or that you can memorize it, know the normal. I didn't say memorize it, I said know the normal. Okay? Number 2, understand self-awareness. Have good self-awareness. Know what you are capable of, what you know, and what you don't know. And you better be okay with that. You're never gonna know it all. The person you're learning it from, they don't know it all either. They sure know how to look it up. Utilize your resources were probably the most important lesson you ever learned in nursing school. You are never going to know everything, but you need to know that you don't know. Fake it for a while, but sooner or later, smack you right in the ass. Be self-aware of your own skills. Number 3, know the what. What? Know the what. What? The HPI, history of present illness. What the hell happened? They didn't just show up because they had nothing better to do. What happened? Know the what about everything that's going on with that patient. What happened before they got there, since they've been here, what's happening now. Be familiar with what the hell's going on, otherwise, what's the point? Number 4, know the why. Why are we doing this? Why does that bother that person? Why is it affecting them this way? Why is it affecting me this way? Why is it affecting the patient's family that way? Why is the heart rate doing that? Why am I giving this medication? Why? Why? Know the why. And if you don't know the why, find out why you don't know the why. What? Why you know the why? You know what I mean. Know the why to the why. It made no sense. You know what I mean. I didn't say you had to solve the why. Number 5, know the why not. Why am I not giving Levofit? Why am I not putting an NG down? Why am I not taking the patient for a CT? Why is the doctor not performing this? Why is the doctor not doing that? Why is the pharmacist not saying this? Understand the why not. 5 steps to help you get better at that that thing called critical thinking skills. Know the normal, self-awareness, what, why not. Any question? What did you think of that one? Do you think I'm full of it? Do you have any additional suggestions about critical thinking skills? These are just basic suggestions. I'm sure you've got a ton of other suggestions on how to sharpen your critical thinking skills tool. I'd love to hear from them. What'd you think of the video? Like it? Love it? Hate it? Did it suck? I want to hear about it. Thumbs up. Leave me a comment. Share it. And as always, check your own pulse first.